As we mark World Tuberculosis Day, ECDC stands at the forefront of fighting against this old, yet still challenging disease. Tuberculosis remains a global health threat, affecting millions worldwide and claiming too many lives. Over 36,000 tuberculosis cases have been identified and reported in EU/EEA countries in 2022. Around 3,300 people have been estimated to have lost their lives that year. These numbers are higher than in the previous year, but lower than in pre-pandemic years. While actions towards ending tuberculosis are showing some positive signs, in the aftermath of the COVID-19 pandemic, we still have a long road ahead of us to meet tuberculosis elimination targets. The timely strengthening of prevention, testing and treatment are key elements in fighting tuberculosis. Any delays translate into further suffering and death. We must always keep in mind that while tuberculosis can affect anyone, the disease disproportionately affects the most vulnerable and marginalized communities, people living in poor housing conditions, people living with HIV/AIDS, migrants, refugees, and people in prisons. One of the biggest challenges in tuberculosis control is ensuring the timely provision of preventive treatment in these at-risk groups. Another important challenge is the emergence of drug-resistant strains, particularly multi-drug resistant and extensively drug-resistant tuberculosis. These forms of tuberculosis do not respond to standard antibiotics, making treatment more complex and expensive. Ending tuberculosis requires more than medical interventions alone. It demands an integrated approach that addresses the underlying factors of tuberculosis transmission, such as poverty, inequality, stigma, and barriers to healthcare. The 2023 United Nations High-Level Meeting on Tuberculosis reinforced this comprehensive approach and renewed the commitment to ending the tuberculosis epidemic in Europe and elsewhere once and for all. At ECDC, our mission is clear: to support efforts in the EU/EEA countries and beyond, aimed at controlling tuberculosis and reducing its burden on individuals, families, and societies. Through robust surveillance, data analysis, and evidence-based guidance, we strive to empower policymakers, healthcare professionals, and communities to effectively combat tuberculosis. Through collective action, innovation, and solidarity, we can turn the tide against tuberculosis and create a healthier Europe. Together, we can end TB.